Hello, my name is Matt James. I'm 35 years old, excuse me, and I have cystic fibrosis. I've been a commercial bank here for the past 10 years, currently serving as a vice president for a local bank here in town. I graduated from the University of Arizona back in 2002, which also happens to be where my CF clinic is located. I live in North Scottsdale with my lovely wife, Ellie, and our two dogs, Louie and Murphy. Now that you know a little bit about myself, I'd like to thank you all for joining us for the One-on-One Live. I have here with me Dr. Anna Georgiopoulos, Assistant Professor of Psychiatry at Harvard Medical School. She is a child and adult psychiatrist who's been working as part of the CF care team at Massachusetts General Hospital for the past 10 years. She has also been one of the core work group leaders for the International Committee on Mental Health and CF, a cooperative effort of the CF Foundation and the European CF Society, which has recently issued the first guidelines about depression and anxiety in CF. Dr. Georgiopoulos is here with us today to talk about what people with CF and their families could expect at future care center visits, specifically in regards to the treatment and implementation of these new guidelines, and for the screening and treatment for depression and anxiety. She will also answer questions that have been previously submitted online during this registration process, and she'll be taking questions as well from our online audience. So Anna, welcome. I'd like to kick things off by talking about what we learned from the Plenary 3 titled, There is no health without mental health. How can some of these mental health issues affect the physical health of people with CF and their families?
Well, we know that depression and anxiety can be associated with physical symptoms like changes in weight, changes in sleep, headaches, and other feelings in your body. It can also affect the experience of pain so that it can make it more intense and harder to cope with and manage chronic pain. The other thing that we've learned about CF specifically is that there are studies to support that depression is associated with lower lung function, with higher rates of CF exacerbations and hospitalizations, with lower body mass index, trouble carrying out daily treatments, and difficulty with quality of life.
So can you talk a little bit more about the types of studies that were done, what did they measure, and what were some of the most important findings?
Well, we know from other chronic disease studies that were done that there can be higher rates of depression and anxiety in conditions like diabetes or heart failure or multiple sclerosis. These are conditions that don't go away, and the stress of dealing with a medical illness that isn't going to go away can be hard to cope with. In addition, there can be physical or biological factors like inflammation that can increase the rates of depression and anxiety in some illnesses like CF. But there was really no comprehensive study to look at the rates of depression and anxiety in CF until a study called TIDE CF. And this was a really exciting study that came out last year. It was an international study of over 6,000 individuals with CF, adolescents and adults, and over 4,000 caregivers of children and adolescents with CF. And this was done over 9 countries and represented the work of thousands and thousands of people and the participation of thousands of people as well to screen for depression and anxiety and find out how prevalent this is. And the results were really quite astounding. So about 10% of adolescents screened with an elevated rate of depressive symptoms, about 19% of adults, and with parents the rates were even higher. Results in over 30% of mothers and fathers had elevated rates of depression. And for anxiety, those were even more significant findings. For adolescents, 22% had elevated rates of anxiety. Adults with CF had reported elevated anxiety symptoms at 32% of the group, and 48% of mothers and 36 or 37% of fathers. So we found that these were very significant and 2 to 3 times higher than what we would expect to see in the general population. Another factor that was really important is to see how this might impact the whole family. So they looked at over 1,000 pairs of adolescents who had been screened, and then the parents who had been screened for depression and anxiety. And we found that that link is really important. So if a parent had screened positive for depressive symptoms, that adolescent, that child with CF of that parent caregiver was 5 times more likely to report elevated depression symptoms as well. And similarly for anxiety, if that parent was reporting stress and elevated symptoms of anxiety, that adolescent with CF was 3.5 times more likely to him or herself feel very anxious.
Were the studies that done that for the CF specifically relative to, people who have diabetes, multiple sclerosis, et cetera, did those numbers match in terms of the percentage of, or the increase in percentage of depression and anxiety, or is that kind of too hard to tell?
Well, the rates are fairly comparable. In general, with folks with chronic illness, we do see elevated rates of depression and anxiety, and particularly those kind of inflammatory diseases. We know that depression now, we know it's an inflammatory illness. So for example, in diabetes, we know that people who start out with diabetes are at risk of developing depression over time, and the reverse is also true. People who start out with depression are then at elevated risk of developing diabetes, and again, that may be through some sort of inflammatory process, but it also may have to deal with the stress of dealing with a chronic condition and coping with all the treatments that go into taking good care of yourself.
All right. Well, now that you guys have done a bunch of studies and you have that data in hand, what people like myself and my family expect from care centers now that you have those results? Well,
so a set of guidelines has been recommended for how we might deal with these elevated rates of depression and anxiety. And the guidelines are recommendations, and it's going to take time for implementation to occur at each center. Each center is at a different stage of readiness. But what you can expect ultimately is that once a year, that adolescents age 12 and up and adults with CF will be screened for depression and anxiety, and also caregivers of pediatric patients with CF will be offered screening at their children's CF center.
All right. And am I going to have the opportunity to opt out, or is this type of mental health screening something that I'm going to be required to do as part of my overall care?
Well, just like with any medical test or treatment, it's your decision whether to participate or not, and that's your right as a patient. So if you're uncomfortable with any part of the screening process, you can always decide not to participate. But what we do know is that the screening is a quick and easy process. We don't expect it to take more than about 6 minutes to fill out the forms. We deliberately selected screening scales that are reliable, valid, and short, and have been widely used in other medical populations. And then at that point, you would be able to talk more with your team, to start a conversation about how you're feeling, and that's really what it's designed to do. How are you managing all of this? How are things going in your life? If it looks like you might be experiencing increased stress or depressive symptoms, then you'll talk with your team to try to start to learn more about whether this could actually represent clinical depression or anxiety that might respond to treatment. And if so, you would be referred to someone within the team or within your hospital or outside in the community who can help you decide whether you want to participate in some treatment. But we do know that treatments for depression and anxiety are extremely effective for most people once they're started. So this is why it makes sense to offer screening. Okay.
Well, specifically related, and you talked about it a little bit, but related to how these tests go and what a low or a high score means. What is the process of, what does it mean first of all, and then what do you guys do with that information?
Right. So these screening scales are very short, 9 questions for the PHQ-9, which is a depression scale, 7 questions for the GAD-7, which is an anxiety scale, and then you'll fill it out. Your care team members will, mental health coordinator will total it up and come show you what the results are and say, look, based on what you're telling me about what you're experiencing, you look like you're at very low risk. Keep doing what you're doing, and call us if any problems come up, or please let us know, and we'll screen again in 1 year. If you're having more mild symptoms, then they'll talk to you more about depression and anxiety, and what you can do preventatively to keep feeling as well as you are, and maybe improve things somewhat, and you'll be screened again at your next clinic visit to make sure things are going in the right direction. If your symptoms are more in the moderate or severe range, then again, they'll do more assessment to figure out, what's going on and put into context your screening scores, because that number doesn't say much about, what your functioning is like. Is this making you have trouble at work or at school? Are you having trouble carrying out your treatments? Do you have a family history of depression or anxiety, or have you experienced those kinds of problems in the past? And all of that will be a conversation that will be put together to talk to you about some options for referrals. Do you want to look into psychotherapy, or would medication be appropriate if you're having more severe symptoms?
Okay. So let's say I'm 16 years old and I go through this test and I get a high score. Who's going to be privy to that information, and are my parents going to be told?
Well, just like any medical screening that's done, the results are confidential, but they would be shared with your healthcare team. In the case of an adolescent patient, they would be shared with your parents, although that adolescent will certainly have some opportunity to speak confidentially with members and privately with members of the care team to talk about what's going on in their lives. If your insurance company pays for the screening, then they may have the right to see the results.
Okay. Well, in terms of, kind of going down that path of I have a high score, we talk to my parents about it, whether if I'm an adolescent or an adult. We don't talk to my parents, hopefully, but, and you referred me to kind of a third-party provider to either, get some more screening or get some treatment. What is it, is it my responsibility to tell them about CF? Are there going to be doctors that are aware of CF and some of the ramifications, et cetera? Is it my job to explain that to them, or is my CF care team going to do that for me?
Well, in terms of confidentiality, first of all, you would have to give your permission for your CF team to speak with those outside providers, and we really highly recommend that you do so. There can be a lot of benefits for having someone who knows a lot about CF take care of your mental health as well, but it's really your choice. You may feel more comfortable with someone who's in your local community because it's logistically easier, or you feel like it's a better fit. It's really important when you're talking to someone that you feel like they get you and can understand what's on your mind. And it may be that you're dealing with issues around your CF, but you might also be dealing with other issues in your life with work or relationships or other stressful things you have going on. But the mental health coordinator at your CF team should be able to help in communicating with the folks in the community who are helping you with therapy or medications, and it's particularly important that you let your team know if you've decided to do that on your own, again, so that they can help in coordinating your care safely. Okay,
so the mental health coordinator, is that going to eventually be kind of the go-between between the help that I'm getting outside of my CF care clinic and the help that I get on my monthly visits or whatever it may be?
Yeah, we hope that that's a role that will be provided within CF centers, and the foundation is making resources available so that teams can expand hours or add someone with mental health expertise to their teams in order to be able to serve this function for you. They can help provide you with lists of providers in your community, and again, help in communicating. And there are also educational materials that we've prepared that teams can use to help educate those local providers about CF, so that won't all fall on you to do.
Okay. If I'm an adolescent, and you mentioned this a little bit earlier, but it sounds like you're going to be screening both me and potentially my parents, right? Is that going to be part of the process that's going to be standardized on a go-forward basis? And if the parents are found to be depressed or have anxiety, what are their next steps? And so I make sure that me as a CF patient, that doesn't inhibit my overall well-being.
Right. So for parents who screen positive, and again, parents can choose to participate, and we certainly encourage them to do so. Every parent will be routinely offered this screening. And if, just like with an adolescent or adult patient with CF, the care team member would sit down with them and go over those scores and what they might mean. And then, for example, at Buffalo, which has been screening for 3 years now, what they do is actually hand that parent a copy of the screening scale and there are lists of resources on the back for places that they've established relationships with, and they say, bring this to your primary care doctor or bring it to one of these mental health teams in the community that knows something about CF, and go talk to them about what's going on, and again, whether you feel like treatment is right for you.
Okay. What type of, obviously having CF is, and all the daily maintenance that goes with it is a big time commitment. If you get diagnosed as having a high likelihood of depression or anxiety, what type of treatment, time commitments, et cetera, can we expect in terms of, ongoing care in that arena?
Well, the model that we're suggesting for treatment is a flexible stepped care model, and what that means is that if you're having kind of mild symptoms, then you might just get some education right there at your CF visit. You might be given information about other resources that are available, and we hope that there'll be more training that's developed for care teams to be able to do that kind of preventative work so that you can stay healthy. For folks who have more moderate or severe symptoms who end up referred for treatment, again, this is the flexible piece. It's stepped care, so we recommend for most people starting with psychotherapy, and then if that's not working as well as you'd like, or if it's not feasible for you, to think about medications. But again, it's depending on your preferences. That's a large piece of what's going to go into your decision about how you want to treat things. If you choose to do psychotherapy, often people will meet weekly or every other week with a therapist to kind of get going and jumpstart their improvement, and then as they're doing better, can space it out. Cognitive behavioral therapy is one kind of therapy that we're recommending, and that can there are lots of models that have been shown with a high degree of efficacy to improve symptoms of depression and anxiety in 10 or 12 visits. So we're not necessarily talking about long-term psychotherapy unless that's something that would be meaningful for you, what you would like to do. But that may play into, that burden of time may play into your decision about how you want to proceed. Okay.
That's good information to know. Thank you. Now I'm going to read a couple questions that were submitted online during the registration process. These first couple that I'm going to read for you here are from people with CF. How will we actually be screened for depression and anxiety?
Well, we talked about that a little bit with the PHQ-9 and the GAD-7. These are two valid and reliable measures that have been used in lots of groups around the world and translated into many languages. And so you'll be handed a copy of that. Some centers are doing that electronically. Others will have it in paper. You'll fill out your answers, and it will ask questions like, in the past 2 weeks, how often have you been feeling a lack of interest or pleasure in activities? And then you will rate that on a scale of 0 to 3. So not at all, several days in the last 2 weeks, more than half the days in the last 2 weeks, or nearly every day in the last 2 weeks. And so as you start to rate that for each symptom, that will be added up, and then you'll have some feedback right there at that same visit about what kind of risk category your answers put you into based on what you're reporting.
Okay. So if I go through this process and, am I going to have confidence that this is kind of the universal screening process that's being handed down to all CF centers? So one of the questions is, we don't want people being confused, skeptical, self-conscious about maybe why some of these questions are being asked about depression and anxiety.
Absolutely. We want every single person to have the opportunity for screening. And we're not, sometimes there's a misconception that psychiatrists or psychologists are mind readers, right? We don't know what you're thinking unless you tell us. And so there are so many people, like those of you who might have tuned into the plenary, we saw Andy doing such a wonderful presentation about his experience with depression and anxiety, but people can look and be very resilient and strong in certain ways and still be experiencing depression and anxiety. So we don't know unless we ask, and we don't know unless you tell us. And that's why every single person would be offered screening, to have the chance not only to reflect on how they're doing at that point in time, but also to start to learn more about the symptoms of depression and anxiety, so that if over the course of the months or the years in between screening, they can start to notice if there's some change in how they're feeling or what they're able to do.
Okay. Well, you mentioned you can only act upon what we tell you. And one of the things with the CF community, in many aspects, we feel overwhelmed by multiple aspects of this disease that need to be managed. And I know it's common that patients try and often succeed in fooling their doctors and caregivers into believing that things are okay when they really aren't. And in many cases, we know the right answers that will make people look the other way. So how effective can this screening be, and how do you avoid that type of fooling mentality?
Right. Again, you're in total control of what you put onto these rating scales. So the information that your care team gets is only as good as what you tell us. But we do hope, again, that it really, even if your scores are very low and you're feeling fine, there's still an opportunity to have a conversation with the social worker at your team or other care team providers about your quality of life and how you're feeling. Which treatments am I doing are really adding to my quality of life? Which treatments I don't understand how these add to my quality of life, or they're taking so much time. So regardless of what your score is, that should be a conversation about how am I doing emotionally? How am I doing with managing all of this? Is there anything I can be doing preventatively? Can I do more exercise? Can I do some yoga? What can I do to help keep myself as well as I want to be, and be able to do the things I want to do in my life?
All right. So, in the, a lot of the stuff that you just mentioned there is good for all parts of society, not just people with CF. And so, how is the approach in dealing with people with depression, anxiety, and CF differ from people who don't have CF? Or is there a difference?
Well, yes and no. So in the short course that we did to start to help CF care teams gain more expertise in this area, one of the things we talked about is the principle of, you would do what you would normally do unless there's a reason not to. So there's a huge amount of evidence out there that we base these guidelines on about effective treatments for depression and anxiety. And so for the most part, we're going to do those same things that we know to be effective. We chose treatments, psychological treatments and medications that have been shown to be effective in adolescents and adults with, again, a high degree of confidence that these things are going to work. Now, are there a few situations where it might be different in CF? Well, yes. So you may want to bring into therapy, if it's relevant, how CF has impacted you, the worries you have related to CF, the burden of time and care, or how this changes the meaning of what you're doing in your life. And also there might be some situations where it might affect, there might be medication interactions that you want to consider that someone without CF might not have to. But for the most part, it's going to be fairly similar to how depression and anxiety is treated more generally.
All right. So that's treatment once you've been diagnosed. Is there anything that we can expect at our care centers in terms of, prevention of depression and anxiety up front?
Yes, this is a piece that we hope will continue to grow rapidly over the coming years. There's a lot that we know about prevention. There's good evidence about prevention of depression in the general population, and we're hoping to figure out exactly what works in the CF population as well. But some of the things we know about is that exercise is an excellent treatment for depression and also could be preventative. So the same things that are good for your physical health are also, they help generate new brain cells in the kind of learning parts of your brain. We also know a specific chemical that the muscles release when you exercise that sweeps away the effects of stress and helps eliminate that from your body. So that's something that all of us should be doing preventatively to keep our physical health and mental health as good as it can be. Getting good sleep makes a difference. There are studies to show that people who don't allow themselves to get enough sleep are higher at risk for depression or anxiety. Good nutrition is important. So again, and we know that relaxation and mindfulness, so things like spirituality or yoga or being out in nature, there's actually good evidence can change your brain function and decrease your risk of depression. So again, what do you find meaningful and pleasurable in your life, and building those things in are just as important as taking care of your physical health in more concrete ways that you have to do every day with CF.
So it sounds like a lot of the things that my CF care team tell me today in terms of preventative medicine is not the right word, but preventative care in terms of exercise and nutrition, et cetera, plays well into preventative care relative to depression and anxiety.
Right, that's right. Your brain is part of your body, so it's not exempt from any of the other things that keep you healthy.
Okay, good. What should a person be looking for if they think they might have anxiety or depression?
Well, some of the symptoms of depression can be depressed mood, but it might change. It might depend on the developmental stage that we're thinking of. Younger kids might be more clingy and seem more anxious. Adolescents might not report a sad mood, but they might experience more as irritability, grouchy, grumpy moods, edgy moods. A lot of kids will complain of feeling bored a lot. And in adults, you can also see some irritability and grouchiness, but also just kind of sad and low moods. You might also notice a loss of pleasure in things. So things you would normally find fun to do, they're just not as fun anymore. So, and you really want to look for that change, right? This is something I used to like to do. Now I seem to not want to go out. My friends are calling me and I'm saying no and staying home. So what's going on? Why am I doing that? And same for anxiety. If you're, in particular for anxiety, it's going to be normal to feel anxious sometimes for all of us, and it's something we want to feel a little anxious so that we take action on things that need some action. But if the anxiety is getting so paralyzing that we're avoiding important things, I don't want to look at my blood sugar measurement because it might be high, it might be low. Or I don't want to go to that clinic visit because I might get some bad news. When you start to see it interfere with the things you need to do to take care of yourself or to function in daily life, I don't want to go out because there might be a crowd there, then you want to start to think, could this be getting in my way, and does it deserve some treatment?
So when we're, when we go to our CF clinic, the first thing we always do is blow into our little PFT device and measure lung function. Has there been any clinical data that shows that somebody who's being treated for mental health issues has seen an increase in their PFT?
Well, we've all seen this in our examples of people that we've worked with, where people might be struggling with taking care of their CF. And when you try to figure out what the real barrier is, sometimes it could be depression or it could be anxiety. And when you treat that, you see that people can get back on track and be functioning the way they used to. I've had a lot of people talk to me about, I'm a really tough person, but I'm not feeling so tough these days. And what's going on? We need to gather that data in a more systematic way so we can really show that improvement. We do know that having depression is associated with lower lung function. What we need to do now, and one reason we're suggesting this kind of systematic screening with standardized screening tools, is so that as a community, the CF community, we can figure out what kind of interventions for mental health do the most, not only to relieve the suffering of depression and anxiety themselves, but also to help with those health outcomes, like improving your lung function, improving your weight, and quality of life.
So if I end up having, I grade out high on the depression anxiety scale, and it turns out to be, something not related to CF, illness in the family, death in the family, whatever, gives people depression or anxiety, is my CF care team a place that I should turn in order to, look for some help there as well?
Absolutely. Your CF care team wants to take a look at your wellness as a whole person, right? And those are aspects of your life that are important because of who you are, but there are also things that, if you're having stress at work or you've been laid off and are having financial problems and that's making you feel really anxious, if that anxiety again then starts to interfere with taking care of your CF, then that may have a real impact on you. So absolutely your care team wants to know whether or not you think that the stress in your life relates to CF or relates to all the other things that we go through in life, all the other ups and downs that we're all prone to.
Okay, so I come in and a mental health worker is going to be implementing this, this questionnaire, this process, et cetera. What is the role of the social worker versus, the psychiatrist in the CF clinic? And, some of those lines may seem to be a little blurred.
Well, and part of that reason is because there can be some overlap in terms of function, and some of the roles that a social worker or psychologist or psychiatrist may play could differ from center to center or even from day to day, depending on what clinic you're in. In general, one of the differences is that psychiatrists are medical doctors who are licensed to prescribe medications. So that's, if you are at the point where you're considering medication, then either a psychiatrist or in some centers, some of the pulmonologists are receiving training so that they can also prescribe medications, at least for the first steps to get started treating depression and anxiety.
We take a lot of pills. If you end up adding another pill to the mix, are there any known complications between kind of your standard? I know there's a lot of medication for CF patients, but has there been shown any poor interactions between psychiatric pills and others?
In general, we selected 4 medications, and they're all SSRI medications. Citalopram, escitalopram, sertraline, and fluoxetine are the 4 medicines that we're recommending. We're recommending these, again, internationally, both here and in Europe. We came to consensus that these are the medicines that have the most regulatory approvals in the widest age range, so they've been studied the most in kids and adolescents as well as in adults, that they're effective for both depression and anxiety, because we see that if you have one, you're at high risk of having the other as well. And they're also easy to use and easy to learn, so there are relatively few medication interactions. We do have a resource along in the guidelines to help providers learn, whether it's the provider on the CF care team or an outside provider that might not be as familiar with CF, that lists a lot of the medicines that are commonly used in CF and which interactions might be significant or which might not. In particular, sometimes people who use linezolid might need to be careful about an interaction with some of those medicines, and those starting or can be, we may need to adjust their doses, but it doesn't mean those medicines can't always be used, or that a medicine can't be used. It might mean adjusting the selection of the medicine or the dosing. Are
you going to provide that list to the third-party provider, or is that going to be, I'm assuming that's not going to be my responsibility when I go to somebody outside the CF clinic, or maybe it is, I don't know.
Well, what I would hope is that the mental health coordinator at your care team would help you by helping provide that information. And so it would be really critical, for example, for that outside provider to know all of the medicines that you take on a daily basis for your CF, but even the medicines that you might cycle through or that you might use for exacerbation, so that person can plan ahead and say, well, if you might be taking this, maybe we'll do things this way or that way.
All right.
But again, we're providing that list of those first step medicines because those are going to be appropriate medicines for most people with CF in most situations, and that can simplify things as well.
So what can I do to start the discussion if these new guidelines are pretty new, as it sounds?
Absolutely. They just came out in the past couple days.
All right, there you go. So if my doctor or nurse doesn't initiate the conversation at my next clinic visit, what can I do to help start that discussion?
Yeah, absolutely. You should bring it up. Have you started screening yet? Where are you with the screening process? And you can always bring up those concerns on your own. Can we talk about how I'm managing with my CF, or can we talk about, I think I've been feeling a little down lately. Is the social worker here? Is the psychologist here today? How do I contact those people? Or talk to your nurse or your pulmonologist or anyone on your care team about it. I think your nutritionist would want to know if your appetite's been low because you've been feeling really anxious, and when you feel anxious, you don't feel like eating. Well, that may be a different way of intervening for that low appetite than if it's related to some other reason.
All right, that makes sense. The next couple questions I have here are actually from parents of a child with CF. First one is, our middle child has CF, and as parents, we are struggling with depression. How do we prepare for the impact of CF on all our children's mental health?
Well, I think the most important thing that parents and other caregivers can do if they're struggling with depression or anxiety is to address that in themselves. Again, in that plenary, we saw such a nice role model for how Andy was teaching his kids how to take care of themselves physically and how to take care of themselves mentally by modeling exercise, by modeling, hey, I go to therapy and I talk about when I'm not feeling so good. And so we know that it can be harder for depression to improve in kids if parents don't take care of their own depression. So you think of it kind of like when you're on the plane and they say, put your oxygen mask on first and then put that mask on to your kids, right, or people who can't help themselves as well. So first of all, parents, take the time to take care of yourselves. It can be really hard to kind of stop that train of thinking I always have to take my kids' needs first. Take care of yourself. And also, it is important to think about the siblings, although siblings of kids with CF can be very resilient and very compassionate and empathetic as a result of growing up in a household where a brother or sister has CF. Sometimes they can also feel a little lost in the shuffle. So it's always okay to ask your care team, can I have another copy of that screen to screen his brother or sister, or can I talk to the pediatrician about how he's doing? Make sure that everyone has a chance to talk about how living with CF impacts the whole family.
All right. The second question from a parent with CF is, in the future, will CF clinics be able to refer patients to a clinic associated with a mental health provider in the same way that referrals are made to specialists in ear, nose, and throat, GI, endocrine, et cetera, that are familiar with CF? Currently, my clinic has a specific physician on staff at the hospital that they refer CF patients to in each specialty except mental health.
I certainly think that's a goal to shoot for at Mass General Hospital. I've been an integral part of the CF care team for over 10 years now. And so I'm at every CF rounds every week, and I'm seeing a lot of folks, again, at various stages of, for various reasons that they may be having trouble coping or just want to talk about what's going on. We also are lucky enough now to have a psychologist as part of our team. So I hope that over time, every center will start to identify a particular go-to person that so there can be continuity of care and a feeling of community built up around all being in this together.
All right. And one more question is, if I think my teenager is depressed, should I mention it during a clinic visit?
Absolutely. That's critical information, right? Because if you're seeing that if you feel your teenager might be depressed, you must be noticing a change, and it must be something worrying you. And you want to figure out if maybe that's what's going on, but maybe there's a substance abuse problem, or maybe there's a bullying problem at school. Maybe something else is happening, and that's a perfect way to start that conversation, and not wait until screening happens, 9 months later, but to say, again, can we talk about what's been going on? Maybe we can use this clinic visit as a time to sit down and say, hey, I've noticed that you're in your room an awful lot and the shades are drawn and you're not with your friends. What's been going on? Your grades have dropped.
All right. We have a couple online questions that were just submitted, and this first one's from a parent. How does a person's faith play into mental health treatment options?
That can be a really critical part of support for a lot of people. There is evidence to show that people who have faith and participate in spiritual activities have a lower rate of depression and anxiety. So if you use that as part of your support network, then absolutely you should use that preventatively. And if you're feeling more depressed, that might be a time to increase your involvement and use those social support resources around you. Often people will find that that's a faith community is one that can rally around them when they're not feeling well. Okay,
the second question that was just submitted comes from an adult with CF. And I think a lot of, I would imagine that a lot of people just in your daily life experience the same thing that this person's talking about, which is, is depression a natural part of CF? And how do you deal with days when you feel like doing nothing?
Well, certainly low energy can be a part of dealing with CF. When you're feeling sick, it can be hard to get out and do things, and I think that can put you at higher risk for depression. One of the key cognitive behavioral treatments for depression is something called behavioral activation, and that means when you're feeling down or low energy, you actually want to go do the opposite, and you want to plan activities in that you would do even if you were feeling well, the things that you would normally enjoy. But I also think it's important to point out, of course, we all have complex feelings, right? And there are going to be times you feel down or stressed or anxious about something that's going on with CF. But that's not a reason to say, well, of course you're depressed, you have CF, so I guess there's nothing that can be done about it. That's not the case. If it's gotten to a point where you're having a different experience, I think depression and anxiety that are at a clinical level really is a qualitative difference in how it feels, kind of like being in that deep hole that you can't climb out of. And also the frequency and the intensity of those feelings can really become overwhelming. So that's a time to figure out, how can I cope with this and how can I turn this around so I feel like I'm experiencing one of a range of feeling and not overwhelmed by feeling so empty or down all the time or so stressed and anxious all the time.
If it's just for a day, just everybody has those days, right?
That's right.
Is that something that you should bring up to your CF clinic, or, if the next day you feel okay, is that something where you just say, oh, that's passing and, I'll kind of move on? I mean, at what point, whether it's for a day or it's fleeting or it's an hour every day, if the CF implementation or the screening process hasn't quite gotten there yet, when should I be bringing that up to my care center?
Well, I think at the point where it starts to impact your quality of life and your functioning is certainly the point to bring it up, but I think you can bring it up even sooner, because it might be, again, an opportunity to prevent it from getting worse. So if you say, I'm feeling down here and there a few days, well, what's that about? What are those times when you're feeling kind of low? Well, it's when I think about, am I going to need transplant at some point, right? And then maybe you have a conversation with your team about, is that a realistic fear? How soon might that be? And you may end up feeling better, or at least better prepared for what's going on. So it may be that some information or education is helpful. It may be changing something about your life, again, exercise or having pleasurable activities, or, hey, maybe I want to change my job. I think that's what I'm sad about. I'm not liking what I'm doing. What can you do so that you're in the best possible position to be getting the most out of life?
The last question we have here is from a parent that has an adult child. Well, an adult with CF, who is their child. How can they be supportive of that child and who they think is suffering from depression? Let me just rephrase that question. Let's just say, for an example, I'm depressed. How do my parents help me with that depression?
Well, what do you think would be useful to you if you were in that position?
That's a good question. I guess as an adult, you typically don't want to hear somebody tell you what to do. So I guess my reaction would be, suggesting to bring up that those feelings or what I may be struggling with at my next clinic visit, and encourage somebody like me to have those discussions when it's brought up, would probably be the best route. Mm-hmm. I don't know. That's kind of hard for me to figure out, because thankfully I'm not in that position today, and I know when people are depressed, sometimes they don't want to hear people who aren't in the medical field tell them how they should be feeling.
Mm-hmm. Right, but maybe to point out, we've noticed a change. Is there anything we can do to be helpful? Is there anything we can do to take any of the burden off of you? And as you said, encouraging people to talk to their care teams, Because it sounds like you're saying one of the things that's really important is for that adult to have a feeling of control. Hey, this is my health. I'm taking charge of this now. This isn't my parents' job to do anymore. But your parents, of course, still care about you and want the best for you. So to figure out, how you can have those conversations.
All right. Well, that's all the time we have for questions today. I'd like to thank you, and I'd like to thank all of you for participating in the session online, and I encourage you to check out some of the other live stream sessions from the NACFC conference these past couple days. If you missed anything, this as well as some other items will be archived on cff.org within the next couple days. Thanks again for watching.